I'm now going to be speaking to Diane Rochford. Welcome, Diane.
Thank you, Victoria.
Well,
Thank you for inviting me to do this.
Well, thanks for joining me. So just moving on to the questions. What have you observed during the pandemic in dentistry, and what challenges do you feel we may face in the coming months?
So I think with regards to patients in practice, I think definitely oral health challenges. We have some patients that have worked really hard on their oral health over this pandemic, over this past year, and then others for various reasons haven't, maybe due to ill health. And also I think mental health as well can have an impact as well on the long term for these patients as well. So, helping to keep them motivated, because some may be feeling, things may have not gone very well for them during these past 12 months. And so it's important that from our perspective, keep motivating, educating and maintaining that good oral health, and the importance of good oral health, particularly during this pandemic, because as we all know, there's links between periodontal disease, systemic diseases, things like that. So
Yeah, absolutely. And how does the whole practice fit into the delivery of best practice oral hygiene instruction for you?
So I think from like the whole practice with regards to like the whole team being involved. So, even from like the front desk team, getting the patients scheduled, getting the patients in, and they're offering and the whole team having the same message to the patients as well. So from everyone from the front desk to the nurses, hygienists, therapists, dentists, everyone having that same message, importance of, good oral hygiene, and working with the hygienist and with the therapist to achieve that good oral hygiene and maintaining it as well for health. And as we just said before, not only for oral health, but for systemic health as well. So making sure, getting the patients in, seeing the patients regularly, obviously within the guidance and what we're supposed to be doing. So, and it has been tricky because of, things like fallow time, the PPE, those kind of challenges as well that we've faced throughout this past 12 months.
Yeah, but that common message, I think, through all members of staff helps
Yeah.
hugely, doesn't it?
Yeah, just keeping that same consistent message throughout. And even in things like literature, newsletters, we've been doing in our practice, we've been sending lots of newsletters out throughout, and just keeping that same and keep repeating that same message as well, so it works for the patients.
Yeah. And how do you feel your delivery of your best practice model of oral hygiene instruction supports patients and contributes to practice profitability?
Personally, as a hygienist, I do a lot of disclosing with patients, so it's very visual. I often take photographs and show them before and after, which again then creates that enthusiasm, that motivation. And it also, it inspires them to want to come back to improve, and they can see the importance of, returning to the practice. I just made, when I was looking as well, I was just making some notes with like things like, using the intraoral cameras and showing patients, this is a really good opportunity for us, and if they've got a broken tooth, a broken filling, if you show them with the camera, if you've got an intraoral camera, you could maybe take some photographs, show the patients, and then that helps that patient to understand the importance of coming back, which, if you have happy patients that are receiving a good service, they're going to keep coming back, which always contributes to profitability of a practice and making sure we keep seeing those patients. So, delivering good oral hygiene instruction, using lots of visual tools, using all your brushes, everything, and then but also showing them where they started and where they finished up, and the kind of how it can benefit them as well. So, and it gives that positive feeling. I had a patient this week who hasn't been in since January of 2020, and he used to come and see me every 3 months, and before we finished our appointment, and I said, shall we go ahead and schedule the next appointment? And he was like, of course, and we've made 3-month appointment. He's in, and he thanked me for the care, for my care and for looking after him on Wednesday. So yeah.
Oh, how nice.
Yeah.
That recognition as well, and also possibly not having been for a while, just recognizing how much we do give and how that ties into best practice and
of course,
the retention.
Yeah.
And what is your experience regarding tooth whitening and sensitivity, and how does that fit into best practice for both the clinician and dental practice?
Okay, so With regards to tooth whitening, I think, it's become more popular because everyone's looking at themselves on Zoom and Teams now. And so, and we're definitely finding that there's a lot of patients that are coming in and saying, I'm looking at myself on Teams, I can see this, I can see that. And whitening is one of them as well. So, we have we have protocols, we have systems in place with regards to our whitening. We have a protocol for the actual program. And things like for managing sensitivity within, like with regards to whitening, we have our protocols, and we manage sensitivity rather than prevent it, because we know that patients are going to have some degree of sensitivity. So think like having, so using things like Biomin to help to desensitize, to prevent, to sort of manage that sensitivity. So we're using things like that, like different products, Biomin, all sorts of things to be able to help with that sensitivity. But having those protocols in place helps that patient, again, to make sure that they can complete the treatment, they have a successful outcome, because actually whitening is a huge practice builder. And if you get patients that have a good outcome, that not only are they happy, but also they often tell their friends and their family. So, and that's a really good way to, to help with profitability for the practice, to grow the practice. So making sure that they where they start from and where they end up, and making sure that they can see that change, that difference, and that they are happy. So if we follow protocols to make sure that we achieve really good, consistent results, and using product, not only the whitening products, but also desensitizing products, we can help to manage that and give them a more positive experience of the whole whitening treatment.
So achieving optimal oral health for all patients is what we collectively aspire to achieve. But how do you feel this translates to being a win-win for both the patient and practice?
Okay, so with regards to optimal oral health, this is our goal. It's our goal with our patients all the time. And we have to make sure that as dental professionals, we're educating our patients, we're motivating our patients, so that not only are we helping them to achieve optimal oral health, but they are going to achieve optimal oral health, which long term is going to have massive benefits and a huge win-win on the practice, because they have good positive experiences. Again, as I've said before, they can see where they started from. We take a lot of clinical photographs to show where they started from, where they, and track their progress, so they can see that dare I say it, a journey. And so that's a good win-win for the practice. It's also good win-wins for the patients, because we're maintaining that health, we're maintaining that oral health, and their systemic health as well. And patients are becoming much more aware. I think this COVID pandemic has really brought it home, the importance of health to the public, to the general public. And so I think it is a real positive for dentistry, and for and hopefully we'll be able to see more collaborative work between dentistry, healthcare, and those messages throughout, really, for patients. So I think the whole thing is a huge win-win on our part.
Yeah. So we contribute to patients' quality of life through their overall care. What do you look for in the products you recommend to also support improving quality of life?
So we work with our patients, and we make sure that we're looking for really good quality products, because if we know that product's going to work, we believe in it, and we can recommend it to our patients, with trust. So products such as Biomin that have really good evidence base, a really good scientific background, and then using it and knowing that it does work really helps us to improve and help that patient with their quality of life. And sometimes sensitivity, patients who experience sensitivity, it can have a really negative impact on their quality of life, for whatever reasons, if it's through erosive tooth wear, if it's through dentine sensitivity. So having products such as Biomin, that's releasing that calcium, that phosphate, the fluoride, it all helps to improve that patient's quality of life and helps them to enjoy their food, their day-to-day lifestyle. And it's so having that good scientific evidence base, and then also the anecdotal, the real world evidence as well, of trying it with patients as well, because not every patient responds in the same way. So having the opportunity to try these different products and use them for patients and get the feedback really does help us as well. And then it encourages us to keep working with them and to keep recommending it to patients as we get more information. So yeah, so it's something that I do recommend often for patients, with regards to dentine sensitivity, with erosive tooth wear, and also with whitening as well. It fits in with lots of different aspects of our oral health care for patients.
Yeah. And I couldn't agree more. It comes down to the patient's experience as well.
Yeah.
If they notice the results that are proved through the evidence as well, that obviously that supports hugely, doesn't it?
Yeah, it
The
does.
patient, and also gives us confidence in our recommendation.
Yeah,
Thank
most
you
definitely.
so much, Diane, for speaking to me today.
Thank you, Victoria. Thank you for inviting me to speak. It's been really fun.
It really has.